It's all about CEREC with 2 interviews coming up. Hi, I'm Allie Cook. Today's October 12th, 2016, and this is your Wednesday Watch. Here's today's dental news brought to you by Dentsply Sirona. One of the hottest topics at CEREWORLD 2016 was CEREC zirconia. Dr. Paul Feuerstein spoke with Dr. Mike Skramstad to get some insight on this new offering from Dentsply Sirona. Here's part of their conversation.
We know that Sirona introduced a way to do chairside zirconia this February of 2016, so things have changed a lot. You know, I never really envisioned myself using a lot of zirconia, but now on all second molars, that's all I do is zirconia.
And the beauty of zirconia, and I'll ask you, I'm not sure, but I assume you can do less tooth reduction also.
Correct. Yeah, there's not really a defined preparation design. You know, you could prep, if you want to prep a chamfer or even a knife edge, you could do that. But the biggest thing is obviously the less tooth reduction. So where with a ceramic you might need 1.5 millimeters of final thickness of your ceramic, with zirconia we can go down to like 0.7. So it's almost half the amount of reduction that you really would need with a glass ceramic.
And it's certainly more durable. But you can, so when you actually do tell me a little bit about the zirconia process. So do you just stick a zirconia block in your old mill, or is there something else you have to do?
You know, well, there's a couple different milling options that Sirona has. The traditional milling units that have been around forever, it's more, we say milling, but it's technically a grinding process where diamonds grind with friction, they grind it wet. So you still can use that with zirconia, or the new process that Sirona came out with this year was the dry milling. So actually milling in a dry environment. And the difference between the two is just basically time. So if you have a zirconia milled dry, then you can put it in the sintering furnace. That's about 50% faster in the sintering process. Whereas if you grind it wet, you have to undergo a drying process before sintering.
Oh, so how long is it in the fast set? In the fast system, how long is that? Just
anywhere from 13 to 17 minutes. So it's still, I mean, by industry standards, it's really incredibly fast.
For yet another perspective on how CEREC can positively impact the dental practice, Dr. Feuerstein spoke with Dr. Frank Brown. These full videos can be seen on our website, but for now, here are some highlights from their chat in Orlando.
Yeah, so what we have now is CEREC gives us the ability to scan intraorally and then to design crowns and mill them. In an edentulous plate, in a edentulous spot, what we can do is design the crown where we would want it to be. If it's a 3-unit bridge, design it exactly where we want the final restoration to be. We can take that image and import it into the Galileo's 3D cone beam scan.
So you superimpose it basically.
So we superimpose it. So now when I have a 3D scan, so I can see everything in 3 dimensions, I can place that final restoration now on that 3D scan and then virtually place my implants exactly where they should be from a prosthetic standpoint, not only where the screw comes out, but where the tooth is. I can see how much bone I have, so either I need to use a different diameter implant, maybe wider, maybe smaller, or maybe do some grafting at the time of placement.
But at least you're not going in there with your eyes closed.
But I'm not going in with my eyes closed.
No, surgically though, for the patient, what does this do for the patient? You're not flapping now.
Right, because now I can take that virtually placed implant, that implant plan, and I can either send it to SciCat, which will make a surgical guide for me, or if it's a smaller, if it's like a 1 or 2 implant case, I can now send it back to my CEREC and mill my own surgical guide.
Thanks for checking out the Wednesday Watch. Stay tuned next week for more news from CEREWORLD 2016.